Welcome to the world of cardiology again, the study of the heart. This is Dr. Jaitly. In this pertinent section, I'll be talking to you about hypertension. Why is it important and what is hypertension? Well, hypertension is high blood pressure resulting from numerous causes, but the normal blood pressure one should know is 120/80. And that's checked in a doctor's office with the help of a cuff and a gauge and a stethoscope. When the doctor listens to your heart sounds by putting the stethoscope in the arm, and as the cuff deflates, it gives the doctor signals what your blood pressure is, the higher value, and what the lower value is. Now, it's important to know that anything over 140 is considered as abnormal. Doesn't mean that it's very alarming, but the fact is that it should require medical attention, treatment, and it's a good point to really initiate a discussion with the doctor and say, look, my pressure is 140 and above. What should I be doing? So that we'll discuss at a different video presentation, but let's understand the importance of hypertension and at least understand what is high blood pressure. Now, we know that it does cause damages to the kidneys. The hypertension can cause damages to the kidneys, and also it not only causes damage to the kidneys but to the heart. And one is more prone for stroke as well as heart failure. Now, these are conditions that the doctor will tell you that the heart can take a brunt, the kidney can take a brunt because of the pressures being high. Remember, Mother Nature has given all these organs primarily to maintain a blood pressure 120/80 throughout your life. Over a period of time, the hardening of the arteries occurs. There are genetic reasons where one can actually start to notice high blood pressure creep in slowly past the age of 40, 45, 50. Now, genetic reasons, of course, you cannot modify because it's coming straight from your parents and grandparents. So it's too late to choose your parents, as they say. But the fact is that, if your parents or your grandparents or your uncles and aunts have history of high blood pressure, the chances are you will inherit one time or the other during your life, whether it's early, middle age, or later on. So the hardening of the arteries are very, very typical, and it's not good to harden the arteries because arteries are meant to be elastic by nature. So in other words, they can sustain a somewhat pressure as the pulse of that arterial flow travels through it. But if the arteries are hard, then the chances are that they may cause more damage within the organ, within the vital organs. So it's very important that blood pressure needs to be at a level of 120/80 throughout your life, throughout the day. So this way your heart and kidney are not damaged and you don't suffer a stroke and your heart failure never occurs. So the bottom line is there are certain places where high blood pressure is commonly seen. One, places where people have excess body weight, people indulge in overeating, or there is some pattern of lack of activity where a person doesn't exercise at all. And so all of these may be the features of high blood pressure as we see through our days in a day-to-day life. So it's important for us to know what high blood pressure is. Anything over 120/80, especially after 140, needs an attention and treatment. And why is it important? Because it causes all the damages we just talked about, like heart and kidney, and it's prone for stroke and heart failure. Thank you for your attention. We'll talk to you again in the next presentation more about